Hi everybody, it's Aubrey at Moxie Mind and Body downtown Pittsburgh. So for your tip this month, I'm trying to find things that I'm kind of seeing happen across the board within clients that might be tips to help you within your practice. So one of the big things I also see happen across the board, last month we talked about how we hold the handles. This month I want to talk about what's happening in our pelvis and our lower back when we're setting up to do something. I'm going to use the 100 as the example. For some of you guys, I've started having you work with rolling a little bit of a towel up within your lower back. Some of you, it might be so that you can actually get some tactile feedback in there because your lower back curve is overly excessive. For some of you guys, I've been having you work with a towel behind there because you like to squish the mat with your lower back, so it's acting more like a barrier. So I just wanted you to see what it looks like when you aren't using a towel, or what you're trying to accomplish from using that pillow or towel, or if you're not working with one, what should be happening in your body. So everybody's body is different. So when I lie back on my mat, and I have my shirt pulled up so that you can kind of see what's going on in the low back there. When I lie back and I have my arms reaching up to the ceiling and my legs long, can you see how there's a little bit of actually light and air between my lower back and the mat? So we want to actually respect that. Some people might be closer, some people might be further away. And that's why maybe we have the pillow there to give you feedback, or that this isn't happening. See how I tucked my pelvis and now I'm compressing my low back? So respect the curves of your spine when you're lying back here. And then when I curl up, watch the space between my low back and the mat. Yes, it might actually touch. There's no space there anymore, but that's because both ends of my body have lifted, and now I'm curling up and reaching around my pelvis. I'm still not squishing my low back down into the mat to compress, because that would be compression. So we want to keep length and space and lightness. So there's your tip for the month, and I'll see you next month.